Chadwick Boseman, the actor who plays the Black Panther in the Marvel series, recently passed away from colon cancer after battling the disease for 4 years. He was diagnosed in 2016. The question that many persons are asking is, what is colon cancer and how can it be prevented? Colon cancer is a type of cancer that starts in the large intestine, which is known as the colon. The colon is the final part of the digestive tract. Colon cancer mostly affects older adults, although it seems that it can happen at any age. Colon cancer usually starts as a small, non-cancerous or benign clump of cell that the medical teams refer to as polyps. These polyps form on the inside of the colon. Over a period of time, some of these polyps can become colon cancers. Let's review some lifestyle changes that can reduce your risk of colon cancer. It is very important that steps are taken to reduce the risk of colon cancer. However, these changes have to be made in your everyday lifestyle. You can easily start by eating a variety of fruits, vegetables, and whole grains. Fruits, vegetables, and whole grains contain vitamins, minerals, fiber, and antioxidants. All of these ingredients play a critical role in cancer prevention. It is also very important to choose a variety of fruits and vegetables so that you can get a myriad of vitamins and nutrients. Another critical element of change includes the reduction in the amount of alcohol that is consumed. It is recommended that alcohol is consumed in moderation. It is also said that if you choose to drink alcohol, you should limit the amount of alcohol that you consume to no more than 1 drink a day for women and 2 drinks per day for men. It is also highly recommended that smoking should be stopped. It is advised that each person speak to their doctors about ways to quit smoking, and that they should find ways that will work for them. Exercise is also paramount, so it is recommended that exercise happens most days of the week. The medical personnel have recommended that each individual should try to get at least 30 minutes of exercise each day of the week. If you've been inactive, start slowly and build up gradually to 30 minutes. It is also advised that you speak with your doctor before starting any exercise routine. Maintaining a healthy weight is also of great importance. It has been advised that if you are at a healthy weight, one should work to maintain their weight by combining a healthy diet with daily exercise. If it is that an individual needs to lose weight, they should speak to their doctors about healthy ways to achieve their health goals. There should be an aim to lose weight slowly by increasing the amount of exercise you get and reducing the number of calories that is consumed. It has also been mentioned that some medications have been found to reduce the risk of precancerous polyps or colon cancer. Take, for example, there have been evidence linking a reduced risk of polyps and colon cancer through the regular use of aspirin or aspirin-like drugs. But it is not clear what dosage and what length of time would be needed to reduce the risk of colon cancer. The consumption of aspirin daily has some risks, including gastrointestinal bleeding and ulcers. These options are generally reserved for persons with a high risk of colon cancer. There is not enough or sufficient evidence to recommend that these medications be given to people who have an average risk of colon cancer. It is, however, recommended that if an individual has an increased risk of colon cancer, that they discuss these factors with their medical personnel to determine whether preventative medications are safe for them. Preventative measure. Medical personnel recommend that individuals screen for colon cancer. This is recommended for persons with an average risk of colon cancer, and it is recommended that they should consider colon cancer screening close to the age of 50. People with an increased risk of colon cancer, such as family history of colon cancer, should consider screening before the age of 50 and even closer to the age of 40. There are several screening options, and each option has its benefits and drawbacks. It is recommended that individuals who are at risk or who need information speak with their medical doctor and sit down and make a decision in regards to the tests which are appropriate for them. The factors for colon cancer include age. It is believed that cancer is more common in persons older than 50, although the rates of colon cancer in people who are younger than 50 have been increasing. Another risk factor is the African American race. It seems that African Americans have a greater risk of colon cancer than do persons of other races. It is also stated that persons with a personal history of colorectal cancer or polyps are at greater risk. Persons with inflammatory intestinal conditions, along with persons with inherited syndromes that increase colon cancer risk. Persons who are also at risk include those with a family history of colon cancer, persons with low fiber and a high fat diet, persons with a sedentary lifestyle, which means that these persons are inactive, and these persons are more likely to develop colon cancer. Therefore, it is highly recommended that regular physical activity is done to reduce the risk of colon cancer. Persons with diabetes, obesity, persons who smoke, persons who consume alcohol, and persons who have undergone radiation therapy for cancer are said to be more at risk of colon cancer. Like, comment, share, and subscribe. Leave your feedback down below on the important issue of being screened for colon cancer. Please be safe and remain healthy.